the 21st of November 2023, the Mixed Migration Center hosted a research and evidence launch workshop, which served as a culmination of the first 2 years of the East African Migration Routes Project, also known as EAMR.
MMC is a research institution that sits within the Danish Refugee Council, and our overarching aim is to collect empirical data and inform programming and policy.
The EAMR project aims to enable migrant children and youth to have improved access to shelter, protection and health services along migration routes in Ethiopia, Sudan and Egypt, and to support countries to develop policies and local capacities to promote the protection and self-reliance of children and youth in displacement. Supported by the Swiss Agency for Development and Cooperation, the project is one facet of Switzerland's larger efforts to strengthen state and non-state actors to better respond to the risks of exploitation and violence faced by children and youth on the move.
My expectations of the event today is to network with people, to learn new facts about this children and youth on the move in East Africa. So far it has been really exciting, enriching, and I'm happy and thankful for the organizers.
The project is a collaborative effort involving Save the Children International and MMC and is funded by the Swiss Agency for Development and Cooperation.
Save the Children in general is very conscientious about specifically working towards protecting children, and in migration that means preventing unsafe migration rather than necessarily preventing migration.
I think I'm just happy to see this coming together and this kind of coming to the point where there's, I guess, a lot of data and evidence that is starting to come out and that is starting to also not just exist, but also kind of be pushed out to the audiences.
As we mentioned, this is a 2-year partnership in the making, and the project was impacted by dramatic changes in the context, both the COVID pandemic, conflict in Tigray, and of course the conflict now in Sudan. What's MMC's role been in this project? Because this project is much larger than MMC. I mean, what we're not seeing here, but what actually was discussed last week at SAVE's learning event is a pretty large-scale 3-country project aimed at children and youth on the move. And MMC, our role is really as the main research partner within that project. And it's grown out of the recognition that there is a dearth in empirical data focused on children and youth on the move who are actively on their way out of East Africa, transiting countries like Sudan.
The EAMR project aims to develop and implement evidence-based programming that targets enhancing the protection and self-reliance of children and youth on the move in Ethiopia and Sudan.
After almost 2 years of working together with the MMC through this project specifically, I think it's really to try and see how close we've kind of gotten to the original intention of really strengthening our knowledge of children on the move and youth on the move, and not just what drives them initially. I think that's very important to kind of know when doing case management, but also maybe more specifically where they encounter which particular risks and vulnerabilities.
Notably, the most commonly cited dangerous locations of all respondents in Ethiopia was the Hitsats refugee camp, followed primarily by locations in South Sudan and Sudan. For respondents in Ethiopia, the locations didn't massively change before and after the conflict, which of course makes sense. And when you pull out specific nationalities, so when we look specifically at South Sudanese, we see then that the dangerous locations shift primarily to South Sudan and Sudan as they're transiting on their way to Ethiopia.
First, I would like to reflect on the movement dynamics, not only for the migrants and refugee population in Sudan, but also in the current IDP crisis that is happening within the countries.
So when it looks to migration and the movement in general, you will see that pre-conflict, pre the Sudan conflict, we were focusing more on issues of IDPs and refugees. But now when we look at the current conflict, there is a lot of internal movement. We're talking about 4.9 million that are newly displaced. So it will also be helpful to look at the internal movement within the context of Sudan, the current IDP crisis, how this is also affecting their protection, their resilience, their migration or cross-border or even the internal movement itself.
Eastern Horn of Africa, despite that it only constitutes 5% of the world's population, it constitutes 14% of the migrants and largely the forcibly displaced people. The two countries in context in which we are speaking about, Ethiopia and Sudan, constitute the largest share, even by African measures. They have over 10 million forcibly displaced people.
The focus of what I'm going to be speaking about is more on the situation in Sudan, and I think that it has really affected all demographics of people, the crisis in Sudan, as sort of came out through the data. Prior to the conflict, it was one of the largest hosted one of the largest refugee populations in the region, and it's also a key origin location. So the context there, and I think that the protection risks facing children are really significant for all of our work because of the sort of consequences beyond that.
Yeah, we could see that, for example, in Sudan. In the last couple of months, there are a lot of Ethiopian families, a lot of Ethiopian children who were born in Sudan, and when the conflict started, returning to Ethiopia, and they have specific needs, being with their caregivers, with their families abroad, and then either moving on or returning. Their specific needs. We could see that Ethiopian returnee children and youth in Ethiopia, when they came back from Sudan, faced challenges, for example, related to IDs, related to their documentation, that if they didn't have the Ethiopian ID, they were constrained in their movements. They had to wait until they get an Ethiopian ID. So those kind of things, there could be more of a collaboration between countries. Also the progress that IGAD is making towards the protocol on free movement potentially can improve this. And also between countries in the region, recognizing each other's IDs would be a good step.
Little children are born during the journey, and there, as we said, we can see additional vulnerabilities and needs and challenges. And here I can quickly include the lack of documentation. Birth certificate is a big issue. We have children that were moved during this journey there where they don't have birth certificate.
As part of the collaboration, MMC's objective is to generate an evidence base on children and youth on the move in these two countries and to conduct research on the decision-making, aspirations, and protection experiences of this largely invisible population to help guide future good practice, programming, and policy.
So I guess just to put a bit of perspective on it, according to IOM's most recent DTM data, they say there's an estimated 4.9 million people who have been internally displaced and 1.36 million people have crossed into neighbouring countries. It is estimated to be 53% children, so 3.3 million children are affected by the crisis, which is the highest number of displaced children globally. So it's a significant crisis in our region.
For the first panel, it was very interesting because they were discussing the protection risk, and we mainly a project that is dealing with protection issues of migrants and refugees. So it has like a very helpful insights when it comes to informing our programming, because within the current context of Sudan, the context is really volatile and there is many development of the context. So those insights will really help us when it comes to programming, implementation, that we have an evidence and that we have a continuous monitoring of the protection risk in general that is affecting our target group.
A kind of an overarching question to this panel has been, why is it so important to understand drivers and movement intentions? And also, how does status feature into this, and how do we capture complexity?
We all know why this trend is higher, but interestingly, as Asma said, even before the conflict, still Sudan, we had a really huge trend of individuals. As you see, they were the second in 2022. There was no conflict then, but there is a trend of youths and adolescents moving from Sudan.
The other section, or the other question that this can be used to answer is refugees, the profile or the proportion of refugees and migrants coming from Eritrea.
When it comes to quite a lot of the factors mentioned, like violence, conflict, climate change, those drivers are kind of things that we can try and address on the one hand, but in many ways mobility is a potentially safe adaptation and response to these kind of pressures. And in many ways, that's where the East African Migration Risk Project sits. So the project specifically doesn't try to prevent migration by doing work in communities of origin, but it is really about trying to, as best as possible, provide protection along the route of those children and youth that have either decided to move or have been, I guess, involuntarily displaced.
The first month after the conflict started in Sudan, that means between mid-April and mid-May, over 27,000 people crossed from Sudan into Ethiopia via Metema. That includes refugees from Sudan and Eritrea and also returnees from Ethiopia.
So to answer the first question from Gregor, we do ask the respondents about the difficulty, the risks that the children face and their perspectives of the risks in other locations. So when we ask, 40% of caregivers reported that the children did not have any risks on them. First of all, this is in Ethiopia. It's also important to note that the location for the interviews may also influence the answers to the questions. You see that in the data in Sudan, a lot of the caregivers reported multiple risks for their children from their perspective.
Within the scope of this project, in the last 2 years, MMC has carried out 1,377 surveys in Ethiopia and 1,595 surveys in Sudan, and created a customized data dashboard open to policy actors and programming teams from Save the Children and other organizations working along the route in Ethiopia and Sudan.
So then in terms of the products that you can expect to have at your disposal to inform your programming and work, I mentioned this large-scale dashboard. If you are interested in using it, let us know. We will send you unique login credentials because we can't just put it online as is. It's quite detailed. And we can also, of course, arrange sessions on how best to manipulate the data within it.
You can get so many insights from this dashboard. You have drivers, intention, perception of risks, assistance, smuggling, some of the data that we have here and insights. We're not going to present in this forum, but they can be really helpful.
The e-dashboard is a very useful tool that has been presented by MMC, because with several clicks and manipulating the data, then you can have an analysis. And that analysis can come from the point of view that you would like to see or to discuss. So for MMC, the dashboard was honestly a brilliant idea, and I really think it will support us with the implementation of our EAMR project.
You're going to have an easy time accessing the dashboard, interacting with it, and we look forward to getting requests from you to access it. And we are willing and available to support you in any way that we can. Thank you so much.
The outcomes of this project underscore the significance of multi-country and routes-based research when formulating programs for children on the move. These findings provide essential evidence for stakeholders to design and implement contextually relevant programs addressing primary protection risks through advocacy, and support the development of policies aligned with international child protection standards.
From that kind of policy level, one layer down, and we know that when children move, one of the really big areas of risk is when they actually cross borders. It's when they might switch from one smuggler to another. It's when they kind of encounter officials and might not have the proper papers, etc. And that kind of particular point requires a very strong emphasis on coordination. So really trying to get stakeholders on both sides of a national border to work together, particularly on case management, on ensuring that family tracing is done and returns are done in ways that are really oriented around the best interest of each particular child.
This study has been conducted in Metema. which is at the border between northern Ethiopia and Sudan, one of the main transit points on the northern migration route.
Here are 5 key messages coming out of this event and the broader EAMR project. Firstly, children are a hidden group within mixed migration data and research, in part because of the greater safeguards and skills needed to access this group, and as such, their specific needs, aspirations, capabilities, and vulnerabilities are often not captured.
Young people could move for various reasons. Well, partly could be they are accompanying their family or their parents who are moving. Partly could be that is the only choice remaining for them.
So why children on the move are vulnerable? This is the first question to ask when assessing the risks. Because they are children, of course, but also because, as colleagues said already, they are often invisible in data and evidence, and therefore there is a lack of child-focused policies and services that create some substantial risk for them.
We ask specifically about services that both Ethiopian youth and child onward migrants and returnees could access in Metema. And none of the interviewed onward migrants received services. They also said, we haven't heard about anyone who received services. And they also didn't have any information or didn't know who to approach. So basically, they were just living like any other local, working, paying their own accommodation, paying their own food.
Similarly, care arrangements along the route are under-evaluated, and data lack the nuance that helps us recognize how to develop adequate programming. MMC surveyed a considerable proportion of adults on the move who were traveling with 4 or more children in their care and who were the sole caregivers to their children, highlighting the scale of needs for some family constellations. Care arrangements can evolve along the route and are not always bound by biological relationships, but can nevertheless be just as important to recognize and support. Family relationships are a key factor in migration decision-making of children and youth. On the one hand, migration can separate families. On the other, it is often an important mechanism for family reunification. Negative family relationships can also be a reason for children to take the decision to move on their own if they are attempting to flee interpersonal violence or forced migration.
So the reasons that different respondents gave us was poverty, hunger, inability to attend school, as well as, especially for female, for girls and young women, family responsibilities.
So one of the drivers that they mentioned is influenced by family dynamics. A lot of youth escaping from domestic violence, forced marriage, child marriage, which is the same, or seeking to help family financially. And as well, misinformation spread by diaspora.
Lastly, children are disproportionately vulnerable to the risks associated with migration, especially from those posed by exploitive smugglers. However, the specific intersections between age and care status directly inform a child's level of agency as well as their vulnerability to protection risks.
When, for example, in Sudan, we now have over 6 million individuals displaced, and a large proportion of them are children, it obviously falls within addressing their immediate needs. So this is very much humanitarian response work that is often, I guess, less suited or maybe struggles with being very comprehensive because there's kind of an urgency to it.
For more information about these key findings and others, please visit our website.
Getting to hear the numbers, the quantitative aspects, the level of migration of people, especially children. Yeah, it's alarming actually, but it's interesting to hear this information firsthand from organizations who work closely on projects that have to do with this. And I think it goes a long way to also inform our work, for I think the second half of this year and also for next year too.
Renowned as a leading source for independent and high-quality data, research, analysis, and expertise, MMC strives to enhance the understanding of mixed migration, positively influence global and regional migration policies, inform evidence-based protection responses for people on the move, and stimulate forward thinking in public and policy debates on mixed migration. MMC, as a global network, operates through regional hubs hosted in DRC regional offices in Africa, Asia and the Pacific, Europe and Latin America, with a global team situated across Geneva and Brussels. Please reach out for any data and research related to this project. The full conference proceedings are available to watch on MMC's YouTube channel.
I really want to once again acknowledge that this has been really the culmination of nearly 2 years and several conflicts of research and evidence that's all really coming to fruition now. What's next for us and this? I think all of these insights are going to be taken forward into our thinking about what's next with our discussions with SAVE for the next year, because the East Africa Migration Routes Project is not coming to an end, only the first phase of it. So that's important to say. Please stay tuned. A word of thanks. First and foremost, I really want to thank the MMC team that has really been behind the scenes making all of this work. SAVE, you guys turned out in full force, extending your trips, flying in. We really appreciate this collaboration, and your feedback has been invaluable, both at the learning event, but also here. And let's keep the conversation going, especially as all these products come out and we start getting to the really interesting conversations around what can be done with the findings. Thank you.